Covishield was given the green light, given the go-ahead. Covaxin right now has been held. No approval was given. More data has been asked for. Is it because possibly Covishield has more empirical evidence in terms of human trials in the country and other data? They've been quite forthright with that. Is that the reason?
Definitely, the data put forth to the expert panel must have been viewed very carefully. The fact also remains that the Serum Institute vaccine is back-to-back on the approval of the same vaccine by the UK government. So there's data coming from international sources. There's data here. I'm quite sure the expert panel has left no stone unturned to look at the efficacy and safeguard the security and the side effects of the subject when we vaccinate them.
Dr. Talukar, keeping in mind with what's happening right now in London, the UK, the fact is more data has been asked for. It clearly does seem to suggest that we've had a larger scope in terms of empirical evidence where Covishield is concerned, especially human trials.
Yes, I think the regulators would want to know more about the phase 3 trials, which were submitted some while back in the UK. I think the biotech vaccine has just finished or is about to finish their phase 3 trials, and I think they would be wanting to look carefully about the number of participants and the experiences the participants had in the phase 3 trials. Once they get enough data of evidence of safety efficacy, I think the approvals should follow for the local vaccines thereafter. Just a matter of time until they get enough numbers and enough safety data, I guess.
All right, okay. Dr. Thakur, I'll come back to you with, you wanted to make a point, I believe, earlier as well. When you're talking about with what Dr. Gupta was saying, India is actually, the mass of it, the numbers that we have, we've conducted some fascinating vaccination drives in the past. Yes, this is the biggest, but would you reckon that this is dealable?
Absolutely. COVID has been unprecedented, a unique situation which we've never faced. And look how the country and the healthcare workers rose to the occasion. I don't think you can compare the UIP protocol to the COVID vaccination drive which will start. This consists of the entire population which has been waiting with bated breath, the entire population which has been semi-paralyzed, and the entire population which is scared. UIP is different from COVID, and COVID has been an unprecedented situation. India has the capability. You'll be surprised how our nurses, healthcare workers, assistants, doctors are all geared up. There is a lot of availability of multitasking specialists, and India is geared up. You should not begin in this chicken-hearted way. We have the vaccine, and I'm sure once this gets conditional approval, as somebody on the panel said, other vaccines which have been approved internationally, maybe the government will give them approval for private use. Maybe they'll be given approval for government use. But as more vaccines get approval, there is going to be more confidence down the line. Pediatric vaccinations means you have to look after the mother and the child both. Adult vaccination, you only have to look after the person getting vaccinated. So it's not so difficult. If there is a method in the madness, it becomes a pleasure to execute it.
Whatever the experience has been the world over, and Dr. Talukar, keeping in mind with what's happening even in the UK, if you are going to try and reflect, how long would you think, till now, of course, this particular vaccine, which is Covishield, has been given conditional approval for the public sector. When would you reckon the private sector can step in, especially in India, where people can actually go buy their vaccine from the shelves of a medical store?
I think that question is going to be difficult for me to answer, simply because at the moment in the UK, all vaccines are being administered by the government free of cost through NHS. So there's no private company involvement here. In India, given my limited experience, I think it shouldn't take long. Once I think there is a reasonable confidence and the public sector starts vaccinating in terms of rolling out the vaccination, I think the companies will apply to the regulatory authorities to seek approval for also marketing in the private sector. And it should be a matter of few weeks, at the most a month, 4 to 6 weeks. I think that would be my best guess,
Okay.
until the private sector then starts rolling it out in pharmacies or private hospitals. So it shouldn't take long, but it's important that the government oversees this and that there's no unfair advantage to people who can pay and get the vaccine.
Well,
It's
yes.
very important that the critical people get it first and then it gets out for other people to use it.
Right.